Recognized for 5 minutes.
Thank you, Madam Chair. I appreciate it very much. Yeah, this is my questioning will be regarding HR 2628, the Vet Care Act, which I introduced. The VA has expressed concerns. This is for the entire panel. We'll start with well, whoever wants to go first. The VA has expressed concerns about apparent disparities created in HR 2628, the Vet Care Act, pilot programs, eligibility standards. Given the logic of the VA, it seems to me that every pilot program VA's ever operated could also be viewed as creating disparities in care for veterans. Indeed, this argument could be applied across the board to all valid, controlled clinical research done in science and in medicine. There will always be limitations and exclusions. Considering the current eligibility criteria for dental care in the first place, can you explain why you agree that this pilot program is a reasonable way to take a first step into assessing the specific benefits of preventive dental medicine at VA, such as the one in HR 2628. Whoever would like to go first, please.
I'll try and address it, but as we said in our written testimony, oral health has a major impact on their physical health, and gum disease is often associated with diabetes, heart disease, and many other serious medical conditions. So a large number of veterans who receive care from the VA are not getting the appropriate dental care needed, and which could later add to other complications of health complications.
Thank you. Anyone else, please?
DAV's been a long-time advocate of dental care for all veterans, it being within a comprehensive care package. As we know, anybody who has health insurance, I mean, dental insurance is an important part of that complete package of care, and we've long wanted to make sure that veterans have access to that. So I think your bill is very reasonable in terms of a start to look at the conditions, as Mr. Butler indicated, that are prevalent in the veteran population, and to kind of mirror this study and as a first step of really offering that benefit.
Anyone else?
Just to agree, I've never understood the disconnect between dental care and medical care. I think, we've all, I think, are in agreement here that it's the whole health that is the important part here, and these should be seen as one thing, so we're very much in agreement.
Thank you very much. And I want to reemphasize that Dr. Jeffcoat from the University of Pennsylvania, who is the former dean of the dental school there, actually helped me craft this bill, and she actually conducted the study, and I worked with a dentist in my community as well, Dr. Zach Calarico, who is a good friend. But let me go ahead and ask one more question. The VA has expressed some concerns that the pilot in the vet care program would lead to veteran dissatisfaction if the pilot disqualifies certain veterans who receive examinations for dental care and are deemed to need surgery. HR 2621, however, specifically authorizes the VA to provide administrative support to ensure those veterans can receive the treatment that they may need. My thought is that the patient is better off than before because they have been alerted to a treatable problem, having received a free examination compared to previously, which must be seen as a significant benefit to the veteran with diabetes. To the panel, do you think your members would be dissatisfied with the pilot program outlined in this bill, especially considering the end goal? And we know what the end goal is, and I appreciate the chairwoman working with me on this particular issue, because we all want veterans who qualify for health care under the VA ultimately to get dental care. So whoever would like to go first, please respond to that.
I think veterans would understand your explanation, and certainly sometimes just even having that first opportunity to really identify, I have a problem and there's an issue here, and hopefully the assistance to, get that care, that they wouldn't be dissatisfied. They may want to make, they would love to be able to have that access to a full treatment, but I think it is a first good step, and it's something. So certainly we'd be supportive of that, and I think most veterans would agree with your logic.
Thank you.
I agree with Ms. Elam, and an informed veteran is a happy veteran to the most part, knowing that they have a condition that they didn't know they had, and then what's the recourse for taking care of that condition then becomes the issue for the veteran if they can't get it in the VA. But not knowing you have a condition is really not a good thing, which could lead to other complications.
Yep, agreed. I'm still in the Navy Reserves, and I have to get a dental checkup from a Navy dentist every couple of years, and it simply is to make sure that you have a proper level of dental care. If they find something wrong with you, the Navy, the Department of Defense isn't going to pay to cover it for you. They alert you that you need to go out and get that taken care of on the private side. If that's the way we're handling our reservists, and I think veterans would understand that it's the same thing, that you're getting access to a determination that you need some support, and then you can go from there. So I think they would be okay with it and understand.
Yeah, and under the legislation, we authorize, after the pilot program, the caregiver, the dentist will refer them possibly to a nonprofit or the insurance program. And that'll be very helpful as well. But I think it's dangerous not to get the examination. So thank you very much, Madam Chair. I appreciate it. I'll yield back. I guess I'm over time. I apologize.
Yes, you too can never say that you've never had extra time on this committee.